So, good morning, everyone. This is Lisa Beata, University Director of Veteran Affairs, Central Office, and United States Army veteran. I'm on the line, and when I say the line, the Zoom recording with the VA and the Department of Veteran Affairs, Veteran Services, rather. So we have a presentation today from the U.S. Department of Veteran Affairs, as well as the Department of Veteran Services for New York City, and I will allow our presenters to introduce themselves. And we'll begin with the U.S. Department of Veteran Affairs.
Yes, good morning, everyone. My name is Lyn Johnson. I'm from the VA New York Harbor Healthcare System. I am a healthcare enrollment advisor in terms of help assisting New York City veterans with getting enrolled in VA healthcare as part of the United States Department of Veteran Affairs. And we want to—
Hello.
Go ahead.
Hello, I'm Melissa Walters. I am the Director of Prevention and Aftercare Services at the New York City Department of Veteran Services.
Good morning, everyone. My name is Amari Espinal. I'm the Senior Engagement Coordinator at the New York City Department of Veteran Services. Basically, we do outreach to get the word out to veterans and their families about any benefits or resources.
Thank you and welcome. And again, this is part of our CUNY Central Veteran Affairs of New York. That's the City University of New York Wellness Wednesdays. Thank you, and you may begin, Lyn Johnson.
Okay, thank you, Lisa. During this time with COVID-19, many CUNY veterans may have questions or concerns in terms of how they may be able to access healthcare services from the United States Department of Veteran Affairs, VA medical centers throughout the 5 boroughs. And my presentation will cover some of the concerns, issues, and ways to be able to receive medical services throughout the VA medical centers in the New York City area. The information that I'm going to be presenting is nationwide, but I tailored the information strictly for the New York City veterans so that you will be aware of how to be able to reach out to your medical providers and also to be able to get assistance with receiving medical care throughout the facility. On this first slide, which has my contact information, as we go through the slides, if you have any type of questions or concerns in reference to anything that I present on these slides, you can either email me or you can call my office and my direct number at 212-686-7500, extension 4218. That is my direct number to my office, and I can be able to answer any other questions outside of this presentation. Can we go to the next slide, please? Department of Veteran Affairs, veterans and their families, caregivers, and survivors have many VA resources available to answer their questions on services related to the coronavirus or COVID-19 available from the Department of Veteran Affairs. The next slide, which is slide number 3, I'm just going to go over the basic eligibility for VA healthcare benefits. So any CUNY veteran that may have any questions in terms of if they have not registered with the Department of Veteran Affairs in terms of receiving healthcare, the basic 2-year minimum of active duty service if you were discharged under honorable or general discharge, or if you had other than honorable discharge due to any certain medical conditions, you will be eligible to enroll in VA healthcare if you served an active duty either in the Army, Navy, Air Force, Marines, or Coast Guard. Just having that 2-year minimum of active duty service will make you eligible to enroll in the VA healthcare system. Next slide, number 4. CHAMP VA healthcare insurance. We do offer healthcare coverage for dependents of veterans who are service-connected rated 100% permanently and total disabled. The survivors of veterans who died from VA-related service-connected conditions who at the time of death were rated permanently disabled, or the survivors of person who died in the line of duty of active duty and not eligible for DOD TRICARE benefits. And we will, on this slide, there's the 800 number, which is 800-733 8387, where if you feel that you fall under that CHAMP VA and you're the dependent of a veteran who's 100% rated, permanently and totally disabled, you will be eligible to enroll in the TRICARE healthcare system to receive medical care at the VA medical centers. Next slide, number 5. TRICARE recipients and VA healthcare. TRICARE recipients are eligible to use VA healthcare for emergent care, which includes veterans, military retirees, military spouses, and eligible dependent children who are of college age. Anything over 18 or older can be able to use any of the VA medical centers throughout the New York City area for any healthcare needs. At the Fort Hamilton, Brooklyn, there's the VA DOD TRICARE office. That is the office that processes the TRICARE recipients in order to enroll you in VA healthcare, and that number is 718-836-6600, extension 2965. You will call that number, let them know that you're a TRICARE recipient and you would like to sign up for VA healthcare at any of the other VA facilities. They will get you enrolled. All you would need to do is present your DOD active duty card if you're a dependent, and then they will be able to get you enrolled for the services to be able to use any healthcare needs at any of the VA facilities. Slide number 6, COVID-19 and financial hardship. We know that throughout the city and nationwide, many veterans who have been deemed ineligible in the past for VA healthcare due to their income being above the means test threshold have been placed on unemployment due to COVID-19. They may now qualify for VA healthcare. It's called a financial hardship. The VA Medical Care Hardship Program may help you qualify for VA healthcare enrollment. If your income has recently changed, which I mean by has decreased because of loss of employment, sudden decrease in income, or increases in out-of-pocket healthcare expenses, we all take that into determination for what's known as a VA hardship determination. What we basically do is get you enrolled for VA healthcare. So that way, if you're a veteran who all of a sudden became unemployed due to COVID-19, we can get you enrolled in VA healthcare to ensure that you have healthcare insurance and you'll be able to use any of the VA medical centers throughout the New York City area. And we can be able to assist you in ensuring that you are provided those medical services. Next slide, number 7. The VA once you are enrolled in VA healthcare and you have any medical concerns, veterans who are experiencing medical concerns are asked to call the VA Nurses Helpline. The VA Nurses Helpline is staffed with live clinicians 24 hours a day, 7 days a week to answer health-related questions. The VA Nurses Helpline is 1-800-877-6976. If you are a veteran, let's say you're experiencing any type of symptoms, you're feeling like you have a fever, a slight cold, or even if you don't have any type of flu-like symptoms, you might have a backache, anything of that nature, please contact that VA Nurses Helpline. They will have live clinicians that will be available to you 24 hours a day throughout the city who will be able to answer your concerns. And if they deem it medically necessary, they will tell you to come in to be able to speak to a live physician to be able to have your health needs addressed immediately. So we set this 24-hour hotline up during the COVID-19 to ensure that veterans' needs are being met via telephone. We can be able to speak to someone who can assess your medical health-related needs right there from your home. The number, once again, is 800-877-6976. Next slide, number 8. COVID-19 and women veterans. We had a bunch of different questions in relationship to women veterans about their needs during this COVID-19 crisis. The basic medical assistance is available to all women veterans at every VA facility. But what we would like for women veterans to be aware that VA facilities are not equipped to care for critically ill pregnant women veterans. Pregnant veterans with mild symptoms can be tested at VA facilities, but pregnant women veterans with severe symptoms can be tested at VA emergency department with OBGYN capacity only. The emergency department will notify the veteran's maternity provider if any other necessarily concerns or any other necessarily things that will be needed for that particular woman veteran if you are pregnant. So if you are a woman veteran and you are pregnant, please call that VA Nurses Helpline. Notify the nurses and the clinicians on staff on that 24-hour helpline. Let them know that you're a pregnant woman, and they will make sure that you are referred to a maternity provider to ensure that your medical needs are taken care of. And once again, that VA Nurses Helpline for women veterans is the same as any other veteran, is 1-800-877-6976. Slide number 9, please. All right, COVID-19 and VA emergency prescriptions. All of the outpatient pharmacies are closed at the VA facilities. What they are allowing veterans to do, if you do have a need to have your medications picked up, what we will do, you call a number, it is 212-686-7500, extension 4438 or 4439. We will have a pharmacist meet you in the lobby of the VA Medical Center, and they will bring your medication to you if you need any emergency prescriptions filled at the VA. So you will be able to get your prescriptions filled in a different process than you normally would in terms of you going to see your doctor. The doctor will fill the prescription and you will have to wait. What the pharmacists are doing on an emergency basis, they will bring the medication out to the front of the building for the veteran to have their medication picked up in the lobby so that they will not have to enter the building and, you know, just for safety precautions. So please just call that number again, 212-686-7500, extension 4438 or 4439. Let them know you're running out of prescriptions and you would like to get an emergency refill of your medication, and the pharmacist will bring it out to the front of the lobby for you to be able to physically pick it up. Next slide, number 10, please. The VA Foreign Medical Program. If any of you CUNY students are traveling out of the country and you need to have any type of service-connected conditions taken care of while you're out of the country, regardless of where you're at throughout, whether you're overseas or you might be locally here within Puerto Rico or any other place else, the VA Foreign Medical Program will be able to help you identify any type of treatment that you may need outside of the continental United States. You will call the Foreign Medical Program office at 303-331-7590. Let them know that you're a service-disabled veteran and you need to have some medical concerns taken care of. What that Foreign Medical Program coordinator will do, they will contact a local medical office in that country that you're currently residing in to make sure that your medical needs are taken care of at the VA's cost. So you will not have to worry about your medical needs being taken care of while you're overseas. You just contact the Foreign Medical Program office. They will contact the local medical providers in the country that you're currently residing in to ensure that your medical needs are taken care of while you're overseas. Next slide, number 11, please. Okay, in terms of, we have a lot of new technology that we hope that veterans sign up for during this COVID-19 process so that you can be able to communicate with your medical providers from your home. There's two programs that's called VA Video Connect and there's My HealtheVet program. VA has introduced the use of technology to enable veterans, families, and caregivers the chance to interact with their doctors, pharmacists, and medical providers. Slide number 12, please. The VA Video Connect program allows veterans to conduct live video visits with their doctors by using the camera and microphone on your video equipment. Slide number 13, please. The requirements for veterans to receive VA Video Connect to home requires a private space where you can be able to have some privacy. Veterans consent to telehealth, which is documented in your medical chart. The veteran either has a smartphone, a laptop, a desktop, or a regular iTablet. The veteran has internet access, Wi-Fi, or 4G capabilities. The veteran has an email address account, and a test call should be completed prior to initial Video Connect appointment. And then you will contact the National Telehealth Help Desk, which is at 866-651-3180. from Monday to Saturday from 7 a.m. to 11 p.m. You will speak to that person, let them know that you want to sign up for the program, and they will help you get started with adapting your technology equipment from your home to the VA so that you can begin to utilize the telehealth services where you can begin to interact with your medical providers from the VA directly into your home. That is with the VA Video Connect program. Slide number 14, please. The My HealtheVet program. My HealtheVet is an online health record, is a personal health record that empowers veterans to become informed partners in their healthcare needs. My HealtheVet gives the veterans the capability to have secure messages, which means that you can send messages to your VA medical providers. Just like online banking, you will set up a secure account, and that way you can be able to send messages back and forth to your medical providers at the VA medical centers. Second, you can download your medical VA notes. If you've seen an eye doctor, foot doctor, heart doctor, different things of that nature, you can order your medications online through the My HealtheVet website to have your medications sent to your home. You can also refill your medications on that My HealtheVet website. You can also download your immunizations and shot records, different things like that. If you need to go to a private hospital, you need to bring your different results of your different labs and x-ray reports, different things. All from the comfort of your home, you'll be able to use this My HealtheVet new online access program that the VA has set up for veterans to be able to use right from your home, to be able to download and be able to use at your convenience. Slide number 15, please. COVID-19 and veterans and well-being. The daily stress of COVID-19, whether or not a veteran is affected or isolated, may enhance other mental health challenges. VA wants to ensure that veterans have the contact information for their mental health treatment coordinator and or primary provider. VA wants to ensure they know they can call the Veterans Crisis Line, which will be a stop with VA staff 24 hours a day, 7 days a week. The Veterans Crisis Line, the telephone number is 1-800-273-8255. You press number 1 for veterans. Let me repeat that. The Veterans Crisis Line is 1-800-273-8255. You press 1 for veterans, or you can text 838-255, or we also have a live chat, which is www.veteranscrisisline.net. I repeat, www.veteranscrisisline.net. Please take advantage of this and pass it along to your fellow veterans who may be feeling some stress during this COVID-19 crisis. Next slide, number 16, please. COVID-19, again, with veterans and well-being who might be feeling some stress during this time of COVID-19. The VA Vet Center program are available in New York City to offer well-being counseling to veterans experiencing stress during COVID-19. The vet centers are VA community outpatient centers all throughout the city, the 5 boroughs. There's one located in every borough throughout New York City that are strictly there for mental health counseling for veterans. They are now stopped 24 hours a day, 7 days a week. There's a 24-hour hotline during this COVID-19 where we have mental health counselors that will be available to you. They offer bereavement counseling and mental health counseling and also family counseling. The telephone number is 877-927-8387. That is 877-927-8387. When you call that 24-hour hotline number, they will direct you to the local vet center program in the 5 boroughs that you currently live in. So don't worry about it. Just please call that number and they will direct you to your local vet center coordinator in the neighborhood that you live in. Next slide. All right, during COVID-19, we might have some veterans who might be experiencing homelessness or might be at risk of homelessness. Veterans experiencing homelessness or at risk of homelessness during COVID-19 can contact VA housing specialists to assist with services. The VA Homeless Hotline will be manned 24 hours, 7 days a week. That telephone number is 877-424-9797. 877-424-3838. I repeat, 877-424-3838. That is the National VA Homeless Hotline number. Also, the VA has partnered with local nonprofits that provide homeless assistance to veterans who may be at risk of being homeless. I will post this information on the PowerPoint for each individual to be aware. That's going to give you a name of some of the few programs that are available to be able to assist veterans. There's Help USA. There is Jericho Project. There is Services for the Underserved and Volunteers of America. I repeat, there's Help USA, Jericho Project, Services for the Underserved and Volunteers of America. They all receive federal funding from the Department of Veterans Affairs to assist veterans who are at risk of homelessness. Please contact any one of your local offices at one of these nonprofits. They are there to assist veterans who may be at risk of homelessness to ensure that you're not going through any type of eviction or anything of that nature, and they will definitely be there to assist you. I'm at the end of my slides. Thank you for your service, and be well.
Thank you. Again, please hold all questions for the end after Department of Veteran Services does their presentation. If you have questions, please put those questions in the chat. Thank you.
Thank you, Lisa, and good morning to all who are joining us this morning. I hope that we're all doing as well as we can during this COVID-19 crisis. So I'm going to go ahead and start off. My name is Amari Espinal. I'm being joined by my colleague, Melissa Walters. We are from the New York City Department of Veterans Services, where we every day strive to improve the lives of New York City veterans, their service members, and their families. So I'll go through a brief overview of what services we provide, both city and some non-city as well. So slide number 2, please. A quick overview. DVS fosters purpose-driven lives for New York City service members, veterans, and their families through 3 methods: community engagement, targeted advocacy, and compassionate service. Slide number 3. We basically have 3 main components, which is fighting veteran homelessness. We have a housing and support services team that works directly with veterans who are in shelter, veterans and veteran families who are in shelter, and we also help with veterans who are at risk for becoming homeless. We have an engagement and community services team as well. Basically, we do outreach to get the word out about various programs, services, and resources that benefit veterans and their families. And then we heal through connection with the Vets Thrive NYC. Melissa will speak on that later on, but it's basically a mental health initiative. You know, we all know that mental health is kind of stigmatized, but you know, we're really here to break down that wall and try to open up those conversations and really, you know, try to come to a solution as far as mental health care. Slide number 4. So DVS is partnered with Vet Connect NYC. Okay, Vet Connect NYC is basically a platform of several veteran providers, veteran service providers, who essentially are case managers and work with veterans and their families on a case-by-case basis. Okay, so there's no wrong door approach. We coordinate services through a team of trained case managers. Okay, you can access the Vet Connect NYC platform by phone, web, and in person. Not right now in person, of course, but when this is all over, in person again, through DVS coordinators. The website is vetconnectnyc.org, or you can call 833-VETS-NYC. I'll say that again. The website is vetconnectnyc.org, and you can call at 833-VETS-NYC. They have over 125 service providers in the network, and we're constantly expanding. Slide number 5, just touch on our engagement team again. Veterans on campus, we work with student veterans across the city, sharing best practices for student veterans in higher education. Done listening tours of New York City colleges and universities to see what issues or dilemmas that we may have that the city could possibly advocate for. We've done learning events such as the Forever GI Bill and sponsored civil service careers through the city's DCAS, Department of Citywide Administrative Services. Slide number 6, touching on employment. I know employment is an issue for a lot of people right now. But just know that there are resources out there. So all Workforce One career centers are closed until further notice, but they will be providing services online and over the phone. Workforce One is administered by the New York City Department of Small Business Services. They provide a dedicated service to veterans and their spouses. They have veteran specialists who work with you to create a resume, do mock interviewing skills. They may be able to help you with finding interview attire. You can get certain training and certification for free through the city. So just know that there are offices in each borough, and you can click on that link. It'll take you to your borough, and you can set up an appointment virtually with one of their veteran specialists there. Slide number 7, continuing with employment, there's a new website. It's called EmpireVets.com. Empire Vets connects employers with military veterans, okay? This is a platform that has a MOS translator. For those of you that don't know MOS stands for Military Occupational Specialty. Basically your job, what you did in the military, okay? And this has been updated. So in the past, there were outdated skills on there. So this is newly revamped to best assess your skills, what you may have done in the military, and translate that to a job that would correlate with your military skills. You can upload your resume on there. You can create a profile. This is also open to veterans and spouses. Veterans, you must upload a copy of your DD-214. Spouses, there right now is no documentation process, so that's off an honor-based system. Just say you are the spouse or were the spouse of a veteran, and you can get services as well. Okay, there are several employers right now that are working to hire for both COVID and non-COVID positions. So that's a good opportunity to get on there and look for employment. Slide number 8. So unemployment right now, I know a lot of people have been struggling to get to the New York State Department of Labor. At this time, the state has developed a new streamlined process as of April 10th to get people quicker access to file for unemployment. So if you need to, you can get on there and check out that process and try to file that claim as soon as possible. Slide number 9. So housing protections do exist for former and current service members using the GI Bill to cover housing costs. So if you're experiencing any type of discrimination or anything like that from your landlord or your property manager, know that it is illegal in the city of New York to discriminate if a veteran is using BAH, or that basic allowance for housing, as income to pay their rent. Okay, there's a partnership between the New York City Department of Veterans Services and the New York City Commission on Human Rights to advocate for that. If you have any issues, that link there will provide you with contact numbers for both agencies, and we will enforce that law to any landlord or property manager who may be violating that local law. Moving on to slide number 10, touching on finance. So through the New York City Department of Consumer Affairs, you can get free financial counseling. I know, again, right now, because of the COVID-19 crisis, a lot of people's incomes may be changing. You may not have any income. You may have less income than you normally do. They have free professional one-on-one financial counseling, services from everything to opening a bank account, to strengthening your credit score, to making a spending or a budget plan, and many more services. So you can call them and schedule an appointment. And then the economic impact payments, also known as the stimulus checks. Okay, if you are an individual who filed taxes in 2019 and earned less than 75,000, you're entitled to the full rate. And if you haven't received it yet, you can go on the link there, which is from the IRS, and it has FAQs for what your current status may be. You can check on the status of your check and see what you may be entitled to. Okay, so that's my piece. So I will be passing it along to my colleague, Melissa Walters.
Thank you so much, Amari, and I thank Lisa Beata and Lynn on that presentation that came prior. So I'm going to go into talking, as Amari mentioned, about mental health, wellness, and other resources. I'm going to begin with Vets Thrive NYC. DVS has a program that falls under the Thrive NYC program, which we call Vets Thrive NYC. And here we see the basic principles of the Thrive NYC premise, which is the roadmap for mental health. So we see there's a change in culture to talk openly about veterans' mental health. We mentioned stigma, and this is one of the aspects we want to share this information. The next principle is to act early and learn how to prevent and detect signs of distress. And I'll be talking a little bit next about the mental health first aid class, which gives non-clinicians, community members, as well as service providers the ability and skill to be able to help to prevent and detect signs of distress in our loved ones. We want to close the treatment gaps and find care for veterans in their communities. We want to partner with communities to tap into the veteran expertise that's already out there in our city. We want to use data better, as well as position government to lead. The next slide. So now we see the mental health first aid. The mental health first aid is a 8-hour class. It can be done in about 7 hours. It's an 8-hour class that teaches the skills on how to support those who may need mental health support or mental health needs. It's not a clinical-based training. It is for non-clinicians, community members, family members, friends, service providers, as well as a clinician. I myself do train this particular class, and DVS trains on specifically the veteran curriculum. So there's the mental health first aid veteran curriculum. One of the things that this mental health first aid that falls under Thrive NYC and is also a division of the Mental Health Association, they are creating remote learning options now. So as that comes through, I will be sharing it with Lisa and her team to be able to share with you guys regarding how that remote learning looks like. So the DVS created the veteran-specific mental health aid program in conjunction under the Vets Thrive NYC, and we have trained more than 286 professionals to work with veterans in this program. It definitely is a training that I do recommend if anyone has the time. I know students have heavy curriculums when you are actively in school, especially with remote learning, but if you are interested, you'll see contact information at the end of this presentation that you can contact us at the office. Next slide, please. So here, I'm just continuing with mental health. This is the slide that really talks about New York Presbyterian Military Family Wellness Center as another option for mental health care. This is confidential and free for military veterans and families. So if you're seeking treatment for PTSD, MST, anxiety, depression, or related military service, please contact either Sarah Such or Marielle Emmerich. This program is specifically for military families and veterans, so we definitely encourage you to reach out. They do have telehealth services, and this is another option for mental health services for veterans and military families. Next slide, please. So we're here talking about NYC Well and Thrive NYC once again. NYC Well is a website which offers a number of well-being and emotional support for you to help you cope. There is a call line, as well as a text line, as well as a chat online. So you can call, text, and chat. NYC Well is in response to, is another arm of the Thrive NYC under our Vets Thrive NYC. So we promote the calling into NYC Well if you want to access services, if you are experiencing or if a loved one is experiencing a mental health issue or crisis. You can also call the New York State's COVID-19 Emotional Support Helpline. That number is 844-863-9314. It's so important right now that we're going through this pandemic. So our city is suffering as well as the pandemic worldwide, and we see that we are coping the best we can. One of the stressors that can happen as a result of what we're going through is trauma and possibly some depression or anxiety. So we just want to give these tools in order to help you and your family and your community be able to reach out and access mental health services and support. So Thrive NYC, this guide identifies resources for all New Yorkers as well as services tailored to the needs of aging New Yorkers, veterans, students, and young people, and people harmed by violence or abuse. In order to access this, you can go to the website indicated at thrivenyc.city of New York. Next slide, please. So here we have the Veterans Crisis Hotline as well as domestic information for domestic violence support. The Veterans Crisis Hotline, if you're a veteran living in New York or New Jersey, you can access to get counseling for trauma and crisis intervention support. There's two ways that you can get through to Veterans Crisis Hotline. You can call 311. You can also call the Veterans Crisis Line at 1-800-273-8255. In case of emergency, you can call 911, okay? For gendered, intimate partner, and domestic violence, one of the factors of being in a quarantine and the city being locked down, unfortunately, there has been a rise in instances of domestic violence. And this is as a result of people feeling stressed, being confined, and maybe even more isolated than others. So these are services for domestic and gender-based violence. We want to let you know you are not alone. We understand home is not always safe. So for services, you can go to nyc.gov/NYC-HOPE. You can also call New York City's 24-hour hotline at 1-800-621-4673. And of course, in all cases of emergency, please call 911. Please, next slide. So here we have some food resources, and so we want to give as many resources as possible. One of the unfortunate casualties of our current city's pandemic is we see more food insecurities, right? And so food insecurities can definitely lend a negative tone to someone's mental health and well-being, as well as being able to provide food for yourself and your family. We want to share these food resources to let you know and your family know that you're not in this alone. DVS is definitely wanting to support, but we wanted to share some public resources that are free to the community. And so first we see Grow NYC. This is for green market locations, and you see the website. Again, we know a lot of our marginalized communities have deficits in getting fresh fruit, and this is definitely a vital piece of supplement. We also have Hunger Free America, which is a neighborhood guide and food assistance. You'll see the website as well. There's also the City Harvest mobile markets, which are distributing free fresh produce. And you can see times, locations, and eligibility in the link below. There's also the Food Bank for New York City, which offers grab-and-go meals and pantry bags to maximize the risk, to minimize the risk of exposure. So for local food pantries, you can go to the foodbanknyc.org/get-help, and you'll see the link below. We also have City Meals on Wheels. They do continue to provide services. You know, City Meals on Wheels has been a well-established organization in our city for many years, and they're still out there providing the service. So City Meals on Wheels definitely is still accessible. We also have the Food Help NYC map. You can visit this map just to see where in your particular neighborhood you have access and where you have access around the city, right? So just to give you more options of where you can get food to supplement for yourself and your families. Next slide, please. So here we have food, resources, and insurance. So again, more food resources. It's definitely a time in our city where we see the struggle with getting adequate food as well as nutritious. So sometimes, you know, just to navigate these public systems, we want to provide more options so you have more options for access. So again, we have Get Food NYC. You'll see the portal here on how you can find food. So this portal is definitely developed in answer to our being remote and being quarantined. With this Get Food NYC portal, you can go and log on and really pre-register to get food at a particular location. And or if you are a senior or someone with a disability, or you don't have anyone else in the household that can access food, you can also put in an order for food to be delivered. Currently, the time for delivery, I believe, is anywhere from 48 to 72 hours. And so the suggestion is to make that food request a couple of days prior to the actual need, just so that you can get that food on time. The Get Food NYC portal is also flexible, where you can go to the site, pre-order, and pick up food. You can also put in an order for someone else that you know is in need and either have that food delivered or have that food picked up. I know that they are giving boxes of food with this particular site. You would want to order enough food for everyone in the household, right? And so the site gives some instructions. So if you know you have a family of 4 or 5, you would want to get more than one box of food. The next website is 3 Free Meals. Will be available for all New Yorkers in more than 400 meal hubs, Monday through Friday. One of the food insecurities that, you know, as New Yorkers, sometimes we take for granted that the Department of Education does provide at least 2 meals for children in our city. And so what the city wanted to do was continue to provide these meals to avoid, again, hunger and food insecurity. So you see the website is schools.nyc.gov, free meals. To access SNAP online, this portal makes it easier in this remote time and this quarantine time that we have. So to access SNAP, which is food stamps, and other food resources and vouchers, you can access online, which is a vital city resource. The next part we're going to talk about is insurance. Now, we know that one of the pieces of this pandemic showed where in our city and in certain communities there is less access to care and less resources. And so we want to give information because we know access to health insurance means access to care. And whether it's VA care or Medicaid, Medicare, or another private coverage, we want to give as much information to ensure that our veteran community and military families have that insurance and access to the knowledge, okay? So we have here Get Help Now for needed resources at nyc.gov/help now. This is a general site that you can just put in the question of what you need and that city resource will pop up, okay? This is going to help navigate that system. Next, we see the New York State of Health Program, which is Medicaid, Essential Plan, and Child Health Plus, year-round enrollment. So you can please apply at the New York State of Health. And there's also a number, 855-355-5777. We also have another access to free and low-cost health insurance, which is access.nyc.gov. Okay, so we just wanted to give this information in order to ensure that you guys as a community have these resources. Next slide, please. So we have, I just wanted to give a little tidbit about the Columbia Lighthouse Project. This is the CSSRS, which stands for the Columbia Suicide Severity Rating Scale. It's a suicide prevention tool to help you, if you come across someone who is in crisis at the moment and may be feeling suicidal. It's a usable tool. It does have a flip side, and I can get some out to Lisa for the template for you guys to be able to see the entire template. There are 6 questions that help you to assess where a person is in that crisis, and on the flip side of this card, it gives you direct tools and steps on what you do. Do you call 911? Do you stay with the person? Do you help the person get to additional mental health services? Next slide, please. And so you see we have here the Suicide Prevention Lifeline. This is also the national lifeline and hotline in order to reach out to someone to talk to an immediate that's in need. If there's an immediate need or immediate danger, of course you want to call 311, or you can call that 1-800-273-8255 or call 911 in emergency, right? So you definitely want to always opt to call 911 in a case of emergency. Next slide, please. So I wanted to talk just really briefly about wellness. On the left side of the screen, you'll see online support groups. These are supports for substance abuse. Again, in times of crisis, you do have a rise in substance use and abuse, and so I just wanted to give resources about meetings that's going on throughout the city and other services to support those in need for substance use issues. So I'm also talking about briefly about alternative therapies. NAMI, which is the National Association of Mental Illness, is offering yoga for mental health. I know that this particular Swan's Nest yoga is about to run its course, so I think they have another 1 to 2 sessions. This particular one is not free. I only wanted to put free stuff on here, but this one has like a cost, I think about $10, $15 per session. But it is remote online yoga classes. And NAMI Basics is NAMI's portal for mental health help and services. So you can definitely go on to NAMINewYorkState.org /mental health programs in order to see exactly what are services accessible within our jurisdiction, within our area. This last piece is New York City parents and teachers can access. You know, we have our young people and our family members at home, and sometimes the kids are getting bored. You know, they're in the house, they're doing remote learning. These are free games and activities for parents and teachers to interact with young people, and they're also family oriented. So this is definitely a tool to help with wellness and alternative ways to spend our time. And so the next slide, and I'm gonna be ending soon. I just wanna share the information about how you can contact DVS. DVS is open Monday through Friday from 9 a.m. to 5 p.m. The office is located at 1 Center Street in Manhattan, room 2208. That's on the 22nd floor. We're right next to One Police Plaza. The 6 train directly to Chamber Street. However, the office is closed due to the current crisis, but DVS staff are working remotely and are ready to assist the veteran community. So to learn more about DVS, you can visit nyc.gov/vet. So follow us on social media at NYC Veterans. You can reach us by phone at 212-416-5250. or email DVS at connect@veterans.nyc.gov. And so when you reach out to this number or you reach out through us through this DVS site, it will be directed based on what your need is, and we direct the calls for someone to be able to answer your need. And so this last slide, please. And so we just want to thank you for your time, and we want to end with this quote from our Commissioner James Hendon. Generations of veterans sacrificed for us to be here, to have the infrastructure, the benefits, and community that we have. It is now our turn to steward the present while making contributions towards tomorrow. Thank you so much.
Thank you. A special thanks to our partners within the Department of Veteran Services, Melissa and Amari. A very special thank you to Lyn Johnson from the VA, as well as the interns and employees veteran employees that are working behind the scenes to support this endeavor. These Wellness Wednesday sessions are being supported by veterans within the CUNY Central Office of Veteran Affairs. If you have questions or suggestions for future presentations on Wednesdays, please email us at veterans@cuny.edu. That's veterans@cuny.edu.